from around the world on general health literacy policy and children's health literacy policy and adolescent. So first I would like to ask you, how did you get involved with health literacy and what is your work today on health literacy?
I encounter occasion to in a conference to know about the progress of the European health literacy movement and campaign in the research setting in 2012, and I realized it's such an important issue but not well understood and not well disseminated in the public in Taiwan by the time. And later I find it's even not well known in many parts of Asia. It's an emerging economy, would be higher demand for better health care, but health literacy haven't been really seriously considered. So that's the reason we start in that.
Yeah.
I am, as an ombudsman, I'm taking not as a scientist but as a political appointee to look at the system of the function and the government. And I always using health literacy as part of the criteria to look at how the system works. For example, prison in the jail, are they being taken care of in their health disease with good health literacy by the customs and the prison himself. And many of the, like road safety, we have many serious traffic accidents here in Taiwan, and health literacy is that to make it aware to the public where are the high risk area for accident,
Yes.
which should be avoided.
Yes.
So I see health literacy is go beyond health sectors.
Yes.
It's a health and society settings and the environment which is all concerned.
And are there any specific health literacy policies here in Taiwan?
The government, Ministry of Health, has been working on this about 4 years ago by the former Minister of Health. He put a few agendas, but the action was not really followed up. Now the health promotion administration, which is under the Ministry of Health, using the hospital organization as a base. I think they focus on hospital health literacy promotion as one of the key. And the second is that they are working on health bureau in the district level, like health centers.
Yeah.
So this is also going to the grassroots activities. So I see in Taiwan more grassroots community health are more incorporating the health literacy at this moment.
And is there anything on children and adolescents at policy level for health literacy?
We are investigating one of the national nutrition status, which is I'm the primary investigator, and we look at nutrition for children. Particularly, we have serious obesity, we have maldistribution of food intake, lack of vegetable, which see has been under investigation, and certainly as an ombudsman, our investigation always push the health sectors.
Yeah.
But this is more than health sectors. For children's nutrition, it's a school, it's an education setting, it's a commercial sectors. So I see the for nutrition in children has taken a multidisciplinary approach. For the home care for the children, which is also one of the very key important. We are looking at how in social welfare can go into the better health care about home care and parent family things. So So there are still area we are trying to see not only health sector but
Yeah,
also
but it's,
from social welfare.
It's a bit across the lifespan
Yes.
of children.
Yeah.
And what are the, from your point of view in the policy world, what are the influencing factors for getting health literacy into the policy work? What?
It takes some education and refreshing for the policymakers. But in Taiwan, most of the time they are looking for how to do it.
Okay.
They want practical tools.
Yeah. Yeah.
You know, they understand important for research, but sees that they are looking for modules.
Yes.
For example, healthy cities, healthy hospital settings. In Taiwan, we still learn a lot from the others. So I see it's important to open the eye for the policymaker to see what are the good model, good practice have been used.
Yeah. And what are the barriers? Why do you think it's still maybe a bit slow in getting into the policy?
I think we need a better avenue because health literacy are not only health sectors, but since it's health, so many others will say, "Oh, this is a health affair."
Yeah.
But actually, health department cannot do by themselves. They need to penetrate.
Yeah.
And therefore, I believe they need some good examples that health department can work with other sectors to promote health literacy together. Education sectors, commercial one, which is also very important. I believe we need to have a few easy, quick catch for the upper levels to understand and know how to do that in their program.
Yeah, and if you focus on children and adolescents, what could be examples of these good quick fixes or quick catches?
There are recent now. There's electronic cigarette issues, paper issues coming up now. I believe we can use this as example. It's a health, but also education and also security. One. So maybe there's a few examples which is cross sectors, and if they understand how to work out as a team instead of one department, could be useful as a test ground.
Are there any examples from other countries that you can think of where you would say this is something we could learn from on health literacy? Are there any regions or countries?
In Asia, in Thailand, I know they are pretty active in promoting tobacco control. We've been quite successful, but it going to some sluggish, and there are some hardcore, and also for the children to stop it. For example, we allow the convenience store, on the shop to sell tobacco on a very easy, accessible way, which shouldn't be a good example. I guess Thailand has some good model for children as advocacy for that.
Who are the stakeholders here in Taiwan that will be involved in health literacy policy making?
Who are the stakeholders?
So here, who will be involved in policy making, or as advocates or opinion makers?
We have a new association which is combined with a lot of education, media, and health group of people, which will be a good example. But there were a few centers, they are more hospital-based.
Yes.
Now we need to community-based worker. I think the patient group would be important player. We also have a consumer protection union, but also there's a committee for consumer protection. in the government.
Yeah.
I think they are also
They are
quite
all-
useful
yeah.
in this way.
Any other things that would be relevant when we do a policy analysis from perspective of Taiwan that you want to highlight?
Taiwan is new democratic and also very free in a society. People are having quick response to the media, ICT, mobile, social media, which will be very good way. I forget to mention about the media.
Yeah.
It's very, very powerful
Yeah.
because the freedom they enjoy and the resources they are having, as long as they have a good direction, I mean, if they have good opportunity
Yeah.
for them to put the issue on hot topic, would be useful to promote health literacy. I don't mean the word health literacy,
No,
but the
you-
concept, the practice of health literacy. I would see media is one of the very, very strong avenue. I hope they can play. There was good occasion for
Yeah.
good example for them to play.
Yeah. Thank you so much. For
Thank
your
you.
time.
Yeah, yeah. Did I answer?